No? So today we discuss the internal iliac branches. Internal iliac artery, its branches. Don't make noise. So today we discuss the write down internal iliac artery branches. So internal iliac artery, it is a branch of common iliac artery. Is it clear? It is a branch of common iliac artery. Common iliac artery. So internal iliac artery, it is the chief artery of the pelvic cavity. It is the chief artery of the pelvic cavity. Okay. The pelvic cavity, this internal iliac artery subdivides into two divisions. Subdivides into two divisions or two trunks. Anterior and posterior. See here, this one is a common iliac artery. Common iliac artery bifurcate gives us two branches. One branch we called as external iliac artery. Another branch we called as internal iliac artery. So internal iliac artery, it is a chief artery of the pelvic cavity. So it runs downwards, then bifurcate gives us two divisions. Number one is the anterior division and number two is the posterior division. See here, is the anterior division and this one is the posterior division. Okay. Now we discuss the anterior division branches. Anterior division branches. Anterior division it gives a number one. Anterior division it gives a number one superior vesicular artery. Number one superior vesicular artery. Superior vesical artery or vesicular. Superior vesical artery number one. And number two, see here is the number two, second branch. Obturator artery, number two, obturator. Number two, obturator artery. And number three, inferior vesicular artery. Inferior vesicular artery. And number four, middle rectal artery. Middle rectal artery. And number five, inferior gluteal artery. Number five, inferior gluteal artery. And number six, internal pudendal artery. Number six, internal pudendal artery. In females, so if male lo untai and female lo kuda same branches, but in females there is a more two branches present. Okay, in female there is a more two arteries. Number one, uterine artery. Number one, uterine artery, and number two, vaginal artery. Number two, vaginal artery. So these are the anterior division branches. So here, first superior vesicular artery, which supplies the upper part of the urinary bladder. Supplies the upper part of the urinary bladder. Okay. Next, second one is the obturator artery, which supplies the external genital organs. Which supplies the external genital organs. And number three, inferior vesical artery, which supplies the lower part of the urinary bladder. Lower part of the urinary bladder. And prostate gland, seminal vesicles in male. Supplies the prostate and seminal vesicles. Next, middle rectal artery supplies the middle part of the rectum. Supplies the middle part of the rectum. Next, inferior gluteal artery supplies the lower part of the gluteal region. Supplies the lower part of the gluteal region. Internal pudendal artery supplies the. So internal pudendal artery is a 4 marks question. Internal pudendal artery is a 4 marks question. So internal pudendal artery supplies the lower part of the rectum by the inferior rectal artery. By the inferior rectal artery. So inferior rectal artery is the number one. That is a branch of internal pudendal, right? So supplies the inferior part of the rectum. Number two, posterior scrotal artery. Posterior scrotal artery supplies the scrotum. It supplies the scrotum. Posterior scrotal artery supplies the scrotum. Number three. Deep artery of the penis. Deep artery of the penis supplies the penis. Deep artery of the penis supplies the penis. Next, dorsal artery of the penis, next branch. Dorsal artery of the penis supplies the dorsum of the penis. Supplies the dorsum of the penis. So this one is the internal pudendal artery. It is a 4 marks question. You must draw this diagram and give the labelings, then write down all those branches. Okay. So this one is the internal pudendal artery. Okay. Next, come to the posterior division. Posterior division of internal iliac artery. See here, this one is a posterior division. So posterior division gives the number 1 iliolumbar artery. Number 1 iliolumbar artery supplies the ilium and lumbar. Supplies the ilium and lumbar. Next branch. Number 2 lateral sacral artery supplies the lateral part of the sacrum. Lateral sacral artery supplies the lateral part of the sacrum. Next branch. Superior gluteal artery. Third branch is a superior gluteal artery which supplies the upper part of the gluteal region. Upper part of the gluteal region. Okay, are you getting? So these are the posterior division branches. Okay, so internal iliac artery is a 4 marks question. Iliac trunk branch is also 4 marks question. Superior mesenteric also 4 marks question. Abdominal aorta and its branches is a 10 marks question. Abdominal aorta and its branches 10 marks. Are you getting? So these are the blood vessels present in our human body. So we doesn't discuss here the upper limb branches and lower limb branches. So whenever we discuss about the upper limb region, then only we discuss this blood vessels. Whenever we discuss the lower limb region, the time we discuss the lower limb vessels. Are you getting? Yes. So these are the blood vessels supplies the complete body. Okay. Then come to the fetal circulation. Fetal circulation. Fetal circulation. So fetal circulation is a 10 marks question. Fetal circulation is a 10 marks. So see here, observe this picture. So this one is the body of the baby. Okay, it is the body of the baby. And see here there is the presence of uterus. So in the uterus wall, it is connected by the placenta. Are you getting? Placenta is a communication between the mother and child. So that is a placenta. This placenta is connected with the uterine wall. Are you getting? Uterine wall ki connection. So economic changes in the baby. Baby carries the nutrients, minerals, salts, and also breathe. Okay. So it acts like a lung. Here the baby in the womb, it acts like a lung. Okay. Here the deoxygenated blood, it becomes a oxygenated. Okay. So here deoxygenated blood, it becomes oxygenated with the help of, see here, these are the pulmonary arteries. These are the umbilical arteries. Now see here, the red color one is a umbilical vein. Are you getting? Umbilical vein. So deoxygenated blood becomes oxygenated blood with the help of umbilical vein. It enters into the umbilicus, passes through the umbilical cord, then pierces the umbilicus and enters into the fetal body. Are you getting? Enters into the fetal body. In the fetal body, it runs above, passes through the sinusoidal spaces, and finally they drains into the inferior vena cava. So inferior vena cava is opens into the right atrium. Are you getting? So inferior vena cava, where it is opens? The right atrium. Whenever the right atrium filled with the deoxygenated blood here, because deoxygenated blood converted into the oxygenated with the help of umbilical vein and passes through the sinusoidal spaces and finally they drains into the inferior vena cava. Inferior vena cava is opens into the right atrium. Here right atrium gets a oxygenated blood. Okay. In the right atrium, there is a presence of two ways. Actually, in the adult stage, there is a presence of only one way. So that way, right atrium to right ventricle, so passes through the tricuspid valve. Passes through the tricuspid valve. See here, this valve is a tricuspid valve. Are you getting? So right atrium nunchi right ventricle ki vellalante tricuspid valve open చేసుకొని వెళ్ళాలి. Okay, so this oxygenated blood here, the fetal life, there is a presence of two ways. Okay, one way from the tricuspid valve, another way from the foramina oval. So foramina oval is a oval shaped hole. It is a oval shaped hole, so which is present in the interatrial septum of the heart. So the blood, whenever it is filled in the right atrium, some blood that directly enters into the left atrium through the foramina oval. Are you getting? So it's a one way. Another way is a tricuspid valve. See here, one way is the through the foramina oval, blood enters into the left atrium. Another way is whenever it filled with the right atrium filled with the blood, then there is a wall is present in between the right atrium and right ventricle. So that valve we called as tricuspid valve. Through the tricuspid valve, some blood enters into the right ventricle. Are you getting? So first we discuss the one way. So first way is through the foramina oval. This oxygenated blood enters into the left atrium. Whenever the left atrium filled with the blood, then there is a presence of one valve which is present in between the right left atrium and left ventricle. So that valve we called as bicuspid valve. Are you getting? What is that valve? Bicuspid valve. Through the bicuspid valve, blood enters into the left ventricle. Okay, whenever the left ventricle is contracted, this blood pushes upwards, passes through the ascending aorta, then enters into the arch of aorta, descending thoracic aorta, abdominal aorta. Finally, abdominal aorta bifurcate gives the two common iliacs. So these two common iliac gives the two arteries. The two arteries we called as umbilical arteries. These are two umbilical arteries. Through this umbilical arteries, deoxygenated blood coming out from the umbilicus, then winds the umbilical vein. Finally, they opens into the placenta. Here, deoxygenated blood, it becomes oxygenated. Again, it passes through the umbilical vein, then through the sinusoidal space, through the ductus venosus. Finally, they drains into the inferior vena cava. Inferior vena cava opens into the right atrium. Here we discuss the second way. So whenever the right atrium filled with the blood, then here there is the presence of tricuspid valve. So the tricuspid valve may be opens. So whenever it is opens, so right atrium blood that drains into the right ventricle. Whenever the right ventricle is contracted, blood pushes upwards, enters into the pulmonary trunk, then enters into the pulmonary. See here is a pulmonary trunk. This one is a pulmonary trunk. So pulmonary trunk trifurcated. Trifurcated means gives a three branches. So two branches from the one is right side, another one is a left side. So right side branch we call as right pulmonary artery, which runs towards the right lung side. In the fetal life, lungs are developed but they not work. Okay, so lungs are developed in the fetal but they can't work. So this blood travels towards the lung side. So near in the lungs there is a presence of deoxygenated blood. So the deoxygenated blood with the help of 2+2 vessels. So the two vessels we called as pulmonary veins. 2+2. Right side two pulmonary veins and left side two pulmonary veins. Totally there is a four pulmonary veins. These four pulmonary veins they opens into the left atrium. Okay, are you getting? Then 25% of the blood only travels into the pulmonary arteries. 75% of the blood that directly opens into the arch of aorta through the ductus arteriosus. Through the ductus arteriosus, 75% of the blood they directly opens into the arch of aorta. Are you getting? So near the arch of aorta, this impure blood and is a mixed blood. So this mixed blood it is enters into the arch of aorta. So arch of aorta, through the arch of aorta, blood runs downwards. The thoracic aorta, descending thoracic aorta, then abdominal aorta supplies the abdominal viscera. Then aorta bifurcate gives a two common iliacs. Two common iliacs gives a two right and left umbilical arteries. These two right and left umbilical arteries carries a deoxygenated blood. So this deoxygenated blood with the help of right and left umbilical arteries it runs outside through the umbilicus, then winds the umbilical vein, then enters into the placenta. The placenta deoxygenated blood it becomes oxygenated. Are you getting? So this type of circulation we called as fetal circulation. This is a 10 marks question. Are you getting? So depressed area called as fossa ovalis. Whenever we cut the umbilicus, we ligated the umbilicus and cut umbilicus ni. Cut chesi umbilicus ni cut chesi and tag chesi. Okay, tag chesi tarvata automatically miga anni changes ayitayi. So what are the changes? See here, ductus venosus it becomes a ligamentum venosum. So ductus venosus becomes a ligamentum venosum. Ide maripindi ductus venosus annadi ligamentum venosum ga change ayipindi. Then foramina oval it becomes a fossa ovalis. Okay, it's the second change. Then see the third change, ductus arteriosus it becomes a ligamentum arteriosum. It becomes a ligamentum arteriosum. అప్పుడు ఇది ఏమైపోయింది ఓన్లీ ఒక డక్ట్ వెళ్ళిపోయి ఒక లిగమెంట్ గా ఫామ్ అయింది. ఓకే, నెక్స్ట్ చేంజ్. సో two umbilical arteries becomes a median umbilical ligaments. Okay, and this left umbilical vein it becomes a ligamentum teres. Okay, see here, left umbilical vein becomes a ligamentum teres. Ductus venosus becomes a ductus venosus. Then foramina oval it becomes a fossa valis. Ductus arteriosus, it becomes a ligamentum arteriosus. Then umbilical arteries becomes a median umbilical ligaments. Are you getting? So these are the changes after birth. ఎక్కడ వరకు whenever take the first breath, so lungs are activated. Whenever the lungs are activated, so this changes will be done. Okay, see here, functionally closed, anatomically closed and ruminant. So ductus arteriosus anna chudandi, ductus arteriosus functionally 10 hours to 96 hours after birth. So functional ga close aithe, anatomical ga close kavalante 2 to 3 weeks. Are you getting? So it becomes a ligamentum arteriosum. Okay, next, foramina oval within several minutes of the birth. So within several minutes lo mee 3 idiots movie chustaru kada, so danlo baby edokapothe koడతారు కదా, కొట్టిన తర్వాత బేబీ ఏడుస్తుంది కదా అంటే whenever take the first breath, అయ్యో పాపం పాప ఏడిపించొద్దు అనుకోవద్దు, కొట్టాలి. కొడితే whenever takes the first breath, so foramina oval అన్నది క్లోజ్ అయిపోతుంది. అయ్యో పాపం చిన్న పాప ఏడుస్తే కొడితే ఏడుస్తుంది కదా అని ఊరుకున్నాం అనుకోండి, ఏమైతే హార్ట్ లో హోల్ ఉండిపోతుంది. ఓకేనా? సో అందుకని పిల్లలు ఏడుస్తే మంచిదే, కానీ రోజు కాదు, పుట్టినప్పుడు. ఓకే, ఆర్ యు గెటింగ్? ఎస్. నెక్స్ట్, see here, ductus venosus within several minutes after birth, functionally it is closed. So anatomically 3 to 7 days after birth it closes. Okay, so it becomes a ligamentum venosum. Ligamentum venosum ga marpindi. Umbilical arteries becomes a umbilical ligaments. Okay, umbilical vein it becomes a ligamentum teres. So these are the changes in the fetal circulation after birth. Are you getting? Umbilical arteries should umbilical ligament ko mark. Umbilical arteries becomes a umbilical ligaments. Yes, are you getting? So is the fetal circulation 10 marks question. So ఒక స్కీమాటిక్ డయాగ్రామ్ డ్రా చేయాలి, ఆఫ్టర్ బర్త్ చేంజెస్ అన్ని కూడా డ్రా చేయాలి. ఓకే, అంటే రాయాలి, డ్రా చేయొద్దు. So take a 5 minutes break, then we start the lymphatic system.